I've been in Boulder for 20 years. I moved my practice to a new facility here in 2001, and because I wanted to provide a sort of a little higher level of dentistry for patients. I was starting to get into computers and really computerizing my office, and my other office had wires everywhere, and it was just sort of this sort of hodgepodge of everything. And in order to kind of clean some of that up, it was just really sort of necessitated a sort of a new design. I was in the public health service in New Mexico and after dental school, and I enjoyed sort of living in the West. I didn't want to live in New York anymore. I do a lot of outdoor activities, so it sort of, Boulder sort of fit really well with a lot of the outdoor activities I was doing. And after I got out of the public health service in New Mexico, I went back to New York and I practiced in a friend's practice in Staten Island for a few months while I was waiting to get my Colorado license. And that really convinced me that I should really leave New York, because as soon as I got my Colorado license, I threw everything in my car and drove out here. And that was sort of the defining moment. And I didn't really pick Boulder as the place that I was going to be. I drove up over the hill and took a look at the Flatirons and said, well, this is a nice place. And it seemed to just click, and it worked out very well for me. I was always interested in medicine, and I always did a lot of things, crafts, and I did a lot of things with my hands. I tie flies for fly fishing, and I make equipment for a hobby of mine called falconry. And always throughout when I was a kid, I always did a lot of like very fine craft things with my fingers and my hands, and I really wanted to sort of bring that into, you know, I sort of somehow was able to combine everything together in my career to be able to utilize my hands and my intellect at the same time. So that's one of the reasons why I decided to go into dentistry. But I also wanted to help people. And I was having a lot of dental problems when I was getting out of college, and I had this tremendous fear of dentists for many years. And I was not a very good dental patient, actually, early on. And basically, I went to some very good dentists after college, and I thought that, you know, I kind of really became more and more interested actually in the field because my experience was so comfortable and so, you know, such a really good experience fixing my own teeth that I really began thinking about dentistry as a career at that point. You know, one of the things that we're able to do now is we're able to change someone's smile and alter their really improve them from taking them from a very painful situation to a very comfortable situation. It's really about changing people's lives. I mean, we're able to, some of my patients we've been able to just completely alter their life in a beneficial way. And I mean, we have patients that wouldn't smile for years, and now their whole personality changes when we're able to, you know, create some of these changes for them. Well, I've gone through this curriculum at the Las Vegas Institute that has really changed the type of dentistry that I do. I started exploring this a number of years ago, and I started looking at some of the cases that were really coming out of the LVI dentists, and they were superior to what I was what I was providing at that time. This was about, probably I want to say about close to 10 years ago. And I was looking at these cases going, gosh, I should really be able to perform this type of dentistry for my patients. And so I decided I was going to take a course at a LVI, and really once I took that course, it was really a stepping stone that sort of brought me through the whole curriculum. And I started really being able to treat very complicated cases in a way that just really simplified everything and made these, you know, and allowed us to have a very good result at the end, because you know what your result is before you finish. You know the result you're going to get at the start of the case. So the confidence level of being able to treat very complicated cases goes way up, and I really feel confident that I can, you know, provide exceptional dentistry for patients. Well, pretty much we want the children to be comfortable. You know, we don't really want to scare someone. We'd like to have the children just come in and we give them a little ride in the chair. We show them a few videos of different animals brushing their teeth. We have a monkey and a dog that, you know, that are going to the dentist for the first time, and it kind of like really sort of connects with the kids, and you know, the kids really like those videos. But we really want to make it a comfortable visit for the children first, and we also want to see really how receptive the children are at that age to dentistry, and you know, we really try to help them become good dental patients. One of the reasons I started orthodontics in my practice, I've always done Invisalign in my practice. I've done Invisalign in my practice for many years, but in neuromuscular dentistry, you really look at the functional aspects of how the teeth fit together. And when you have a patient that comes in, I wanted to be able to give them the option of orthodontic movement of their teeth to solve these functional problems. I think also you should really look at whether or not they're providing up-to-date technology, and that's not being like over technological, okay? Because there's times when new things come out and people buy new technology that really doesn't pan out down the road. It's really finding technology that's long lasting and integrating that into the office properly, and then being able to utilize that technology effectively. The materials that we have available to us today for just regular dentistry now are so cosmetic that it's so intertwined. It's so hard to make a separation between regular dentistry and cosmetic dentistry, because, especially in my practice, because the materials that I use are so aesthetic that when we do just a simple crown on a tooth, the materials that we're utilizing now are so much different than they were 10, 15 years ago that, I mean, the results we get are just astounding. You know, one of the things when you really start thinking about cosmetic dentistry, though, when you're looking at sort of harmonizing the smile, that's really when you really want to go to a cosmetic dentist, is because you really want to harmonize things. When you treat one tooth at a time, as a general dentist, you really don't get a sense of how to put a whole smile together perfectly. Both cosmetic and neuromuscular, we're changing people's lives. You know, I have patients that come in and they can't smile, and we take their initial photographs and we say, smile, smile, you know, and we just can't get them to smile, you know, during their initial exams. And when they leave the office after a cosmetic procedure, it's just amazing to see the glow on these patients' faces. It's really, that's the reason why I'm still in dentistry, is because of these patients. With neuromuscular patients, it's life-changing. I mean, I have patients that fly in to see me, and you know, they fly. You know, I have a patient that is now, she's at Vanderbilt University. She's a music professor, and she was originally treated at the University of Michigan Pain Center at the University of Michigan Hospital, and she was diagnosed with trigeminal neuralgia and on all sorts of medications to control her pain. And we've gotten many patients off of their medications. And this one particular patient came to see me, and we alleviated her pain in a very short period of time, and it changed her entire face. She looked, I want to say, 20 years younger, and she flies in to see us, and she's completed her treatment now. She's just really sort of in just a very minor adjustment phase of her treatment, but just to see those, I mean, just to be able to help people like that is incredibly rewarding.